Welcome to this segment on eczema. My name is Dr. Pony Chang. I'm the founder and director of the River Clinic for Natural Dermatology and Cosmetic Wellness. Eczema is a skin condition characterized by itchiness and redness. Sometimes it can be scarring, weepiness, even ulceration associated with this skin condition. Eczema simply describes a type of skin rash. It is not a disease diagnosis in itself. There are many types of eczema, such as punctilious eczema, atopic eczema, nummular eczema, and etc. The most common type of eczema is what is called atopic eczema. According to the Canadian Society of Dermatology, 17% of Canadians will suffer from atopic eczema at some point in their life. Atopic eczema is also called atopic dermatitis. This is the type of eczema that is most commonly found in children and toddlers. There is a genetic component to this type of eczema. Patients or children with atopic eczema are also very likely to present with hay fever or asthma. Studies have shown that if the child's eczema is properly managed, it will actually decrease their chance of developing hay fever and asthma later in life. The latest thinking in the understanding of atopic eczema involves a protein in the skin called filaggrin. Filaggrin is a protein that allows neighboring skin cells to adhere to each other to form a strong defensive barrier. This barrier prevents bacteria, irritants, and allergens from entering the skin, but also locks in moisture and oils inside your body so that your skin doesn't become too dry. In a patient with atopic eczema, there's a mutation in this filaggrin protein. So what results is that the skin barrier becomes more compromised and open. The skin layers are more open, then irritants, allergens, and bacteria are more likely to enter to cause more itchiness, cause inflammation. But at the same time, moistures and oils are lost because of lack of this adhesive property of this protein. Loss of oils and moisture results in dryness, and dryness causes itching. Itching obviously then results in you scratching the particular skin lesion, and it's actually the scratching itself that causes the eczema. Eczema is known as the itch that rashes. If we can control the itching, then the skin manifestation or the rash appearance of the eczema will actually no longer be able to form. I often teach patients and children to not scratch the skin lesion, but instead to slap the skin instead. Our nervous system is wired in such a way that pain will overcome itchiness. So rather than scratching yourself to relieve that itch, it is actually a lot more effective to just slap the areas that is giving you that itchy sensation. Once your body perceives that painful sensation, you will actually no longer feel the itchiness anymore. It is also important because of this loss in barrier function in atopic eczema to provide a secondary barrier function for your skin. And what we use is a barrier emollient cream to help lock in the moisture in your body and also to make it more difficult for irritants to enter your skin. Most dermatologists will use some kind of petrochemical based emollients. As a natural dermatology practitioner, what I use is a natural emollient derived from the wool of sheep. There is sheep produces a wax in the wool, and this wax called lanolin is the active ingredient of the emollient that I use to help protect the moisture from being lost from your body. Now let's talk about how Oriental medicine understands eczema. In Chinese, eczema is called dampness rash. There is an intimate relationship between dampness and dryness inside your body. We have pretty much a fixed amount of fluids inside our body. So if the skin is dry, then that means the inside of your body must be too damp. Or if the skin is damp, meaning you have the weepy, oozing type of eczema, then the inside of your body must be too dry. In other words, eczema or dampness rash in Chinese medicine is seen as a condition in which the fluid physiology, balance, and distribution is in disharmony. There are many types of patterns for eczema in Oriental medicine. The first type is called blood heat type. This type is akin to the idea of inflammation in Western medicine. This type is characterized with a lot of redness in the skin and very intense itching. Oftentimes there is actually an emotional trigger associated with this type of eczema. For example, following a very stressful life event or following some type of breakup of a significant relationship. The way Oriental medicine would treat this type of blood heat eczema is to use herbs that have the ability of cooling the blood. We'll also use herbs that have the ability of calming the emotions, plus some herbs that have the property of stopping the itching, so that we can put an end to the vicious itch and scratch cycle. It's actually the itching that results in the formation of the rash, and you're going to scratch the skin. Can cause inflammation, which makes the eczema harder to control. These herbs, if they can help you relieve the itching, your body's or your skin will naturally be able to heal itself. The second type of eczema is called the damp heat type. There's dampness and there's also heat. The dampness is what's responsible for the weepiness or the oozing in the skin. When the oozing or the weepiness dries up, it can form crust on the skin as well. The heat portion is responsible for the redness and for the inflammation. So the way to treat this type of eczema will naturally involve draining heat, but also clearing the dampness at the same time. What I also have to do is to combine a topical approach using herbal powders and herbal compress to help draw out the dampness fluids from the skin. And that is supported simultaneously with oral herbal medication that you're taking to help dry out the dampness from the inside. The third type is a combination of the damp heat type and the blood heat type. So naturally, herbs that clear the heat from the blood and drain heat from the dampness will have to be combined simultaneously. The final type is what is called the blood dryness type or the blood deficiency type. This is the type that is the most common in chronic eczema, where the itching isn't all that intense and the redness is more of a pinkishness rather than an intense red that we see in the blood heat type. One of the hallmarks of this type of eczema is lichenification. This means a thickening of the skin as a result of scratching the skin. Your skin is trying to protect itself from the scratching, so it makes itself thicker and thicker to form a barrier, a defense against external assault. The way to treat this type of eczema is to use herbs that have the properties of moistening or moisturizing the blood, so that the blood can then soften these thickened plaques in the skin, so that once the skin is no longer dry, it will no longer itch, and we can finally put an end to the vicious itch and scratch cycle. I would now like to show you some before and after photos from the patients I have treated at the River Clinic. Thank you for watching this video. For more information about River Clinic and how we treat various skin conditions, please visit www.riverclinic.ca.